Hi everyone, welcome to the channel. In this channel we talk about medical topics and lifestyle. Today's topic is erectile dysfunction. So we're covering the incidence, who gets it, what are the causes and the treatments, and most importantly, at the end of the video we're going to be covering what you can actually look at yourself when it comes to your own problems and potentially identify what the causes might be. So let's get into the video. So let's talk about the incidence now. So the most important thing to note about the incidence of erectile dysfunction is that it increases with age. So 50% of men aged 40 to a 70-year-old experience inabilities to obtain or maintain sufficient rigidity of the penis to allow satisfactory sexual performance. 90% of those men are actually too embarrassed to ask for help. So if you're having trouble, always ask for help. And the most important thing is that incidence increases with age. So, what is erectile dysfunction? Well, it's pretty much as the name implies. So, it's a dysfunction of erections. So, whether that be an inability to actually get an erection, or whether that be an inability to keep an erection for a long enough time to have sex. So, we're talking about the rigidity there. Um, and it goes hand in hand with a low sex drive, right? So loss of libido. So that whole cocktail is erectile dysfunction. What is erectile dysfunction? And before we go into actually what causes erectile dysfunction, because there are many causes, I want to just talk about what are the things that you can actually do. Because there are a lot of lifestyle factors that play a role here. And to be honest, it goes hand in hand with a lot of other things. And if we can just get that out of the way first before going into the nitty specifics of the causes, I think we'll be a bit smarter. So, what are the actual things that we can do for erectile dysfunction in our own homes? And these things aren't really just for erectile dysfunction, but they look at it just a healthy life. So whether that be if you're looking at it from a cardiovascular point of view or something else. So things that you should be doing are losing weight if you're overweight, stop smoking, eat a healthy diet, exercise daily, and also stay on top of our mental health as well. Right. So these are important things. I know they sound very, very simple, but I promise you if you focus on these things, majority of our problems will go away. Things that we shouldn't be doing, for example, is practice bad lifestyle habits such as drinking too much or vigorous exercise and so on. So, really basic stuff, but really a lot of us struggle with these healthy lifestyle habits. And now let's get into the causes. So, what are the causes? You can split them up into a few different ways. A lot of the times, people like to think of them as physical causes versus psychological causes. There are other ways of splitting it up. I like to do it as organic causes or psychogenic causes, and then drugs as well. Now, drugs can be under the category of organic causes as well. So just keep that in mind. There's a variety of factors going on there. So let's cover each one here. So the bulk of it actually is organic causes. So 80% of it is organic. So cardiovascular causes, diabetes, neurological, smoking, actual diseases such as Peyronie's disease, which we'll make another video on, and testosterone deficiency as well. So when we're talking about cardiovascular issues, right, then we have the incidence of erectile dysfunction increases by 4 times. So there's more likely to have a issue with our erections. And this is because of the vasculature, the blood flow to the penis, and things like that. So that's something that plays a role there. High blood pressure. This can lead to erectile dysfunction by causing the blood vessels in the penis to narrow, reducing the blood flow. So this is something that's going on there. So let's keep that in mind as well. Diabetes is considered one of the leading causes of ED or erectile dysfunction because it can damage the blood vessels and the nerves that are essential to achieving and maintaining an erection. All right, so that's quite crucial there as well. Heart disease, like I mentioned, reducing the blood flow to the penis, and that's when it comes to organic. So, as you can see, poor lifestyle can lead to organic causes, as well as the natural propensity of that would be that older people suffer with organic causes. Then we have psychogenic causes, so psychological factors that can cause ED include stress, anxiety, depression. These factors can contribute to erectile dysfunction by interfering with the brain's ability to send signals to the penis to initiate and maintain an erection. Relationship problems, poor communication with your partner can also contribute to it. And this goes then into a cycle. So these can potentially be even worse than the organic causes. And then there is the drug section. So certain medications can cause erectile dysfunction. There are much more than just on this list, but they play an important role and can be considered as well as organic causes of erectile dysfunction. What are the actual symptoms of erectile dysfunction? I mean, it's pretty straightforward, to be honest. I mean, the main symptom of ED is the inability to achieve or maintain an erection. Other symptoms can include reduced interest in sex, difficulty getting an erection, trouble maintaining an erection during sex. There could also be an emotional component, so a feeling of inadequacy, low self-esteem, depression. It's important to note that occasional episodes of erectile dysfunction are normal and do not necessarily indicate a problem. But if you're experiencing this over a frequent period of time, then it's important to seek help. Now, when somebody comes in to the office and says, "Oh, I have erectile dysfunction," what are we actually going to be doing? And investigating them as a whole. So not just the penis, but the whole body. Cardiovascular disease, diabetes mellitus. So checking BP, pulse, blood tests. So checking things like testosterone, cholesterol, glucose levels as well. And then we're going to be examining them psychologically as well, right? Seeing if they have testosterone insufficiency. So checking out their genitals, their breasts, their beard. If things are suspected, we do more detailed blood tests like sex hormone binding globulin, LH and FSH, and prolactin. So this is roughly what happens when you investigate and examine ED. Now let's get into some treatment. So how are we going to treat ED? The most important way to treat it is to treat the cause always. So if it's diabetes, try to get on top of the diabetes. If it's blood pressure, try to get on top of the blood pressure. In terms of oral drugs that we could take, first one, most common one, famous one, phosphodiesterase type 5 inhibitors. So this is your sildenafil, your Viagra, as you like to know it. It's effective up to 70% of the time. You use it before sex. You use it once a day. Avoid it in certain situations. This is quite important to know, and that's why usually you speak to a healthcare provider prior to doing anything. There are other oral medications such as apomorphine. There are other ones like yohimbine, which are herbal remedies available over the counter. There are local drug treatments. So these are injections and things like that we won't really get into in this video because you definitely require specialist attention when doing those. There's mechanical devices like the vacuum device, which is where the penis is placed in the device and air is withdrawn to mechanically suck blood into the penis. So there's something like that exists. There's a penile prosthesis, which is usually used as a last resort. It's an inflatable and rigid thing that's placed, a prosthesis essentially. There are other things like androgen supplementation. There's psychotherapy, which can be effective for some, but it's quite time consuming and expensive. But it may diminish the needs for drugs, and it can give a permanent solution if there's a psycho component to it. So loads of different causes. Usually the most commonly known ones are the oral drugs. So that's what we focused on here. But there are other things available out there, and it's important to speak to a healthcare provider if you're looking into that kind of stuff. But honestly, the most important thing is lifestyle changes. So don't fall into that trap of a cardiometabolic picture, cardiovascular disease, diabetes, not focusing on your mental health and your stress levels. Don't fall into that kind of a trap because that's single-handedly the most common thing that we come across. So please focus on the lifestyle changes first before anything else. And now let's get into the most interesting part of the video and the most important. It's how can you know? So how can you know at home? How can you know in which category you fall under in terms of these causes? So psychogenic and organic, or physical and psychological. And it's with a few simple questions, to be honest. And questions are, for example, what is the onset? Is the onset sudden or gradual? If it's a sudden onset, then it's likely a psychogenic cause versus organic cause. Is it a consistent loss of erections or not? So if it's a consistent failure, then it's an organic cause. If it's inconsistent response, then it's a psychogenic origin. So do you ever wake up with a morning erection? Right? That's a very, very important question in distinguishing if it's a psychogenic versus organic. And do you actually want to have sex? So what's going on with the libido side of things? And again, age. So age is usually, so it's not always, right? So it's psychogenic origin is usually below the age of 60, and organic origin is usually above the age of 60, but not necessarily a constant factor there. So these are some simple ways that you can know in which category or which list you fall under. And to be honest, any doctor is going to ask you these exact questions if you present to them with erectile dysfunction issues. So that was the video. I hope you learned something. Like and subscribe for more. Leave a comment in the section below for further topics you'd like us to cover, and we'll see you in the next video.